All right, welcome back to One Body, episode 8. I'm Eden,
I'm Kruesi.
and today we're going a little different. We're going a little different, guys. Today's going to be a little bit different. We're getting to know my beautiful co-host to my left, Kruesi Brock Baker, and along with that, getting to know more about what it means to be a PA.
Yeah.
So lots of questions around how to become a PA. What does that look like? What can you do? How has Kruesi enjoyed it? But first, we have to get into getting to know Kruesi. Somewhat related to that, you just recently stopped breastfeeding your baby.
Going straight to the boobs.
Yeah, straight into that. How old is she?
She's 1 and like 2 weeks.
Okay.
Yeah.
So you breastfed for a while.
A year. Yeah, about a year and a week.
Okay. Was that, is this kind of the timeline you had anticipated?
Mm-hmm. A lot of people outside of America breastfeed a lot longer than a year. A lot of people in America try to get to a year. There's a lot of factors going into like if you can breastfeed, if your baby latches, if you're producing enough, and then especially a lot of the time when you go back to work, like if it's even feasible, because pumping is really time consuming and energy consuming, and it just kind of sucks, to be honest. I have so much respect for people who exclusively pumped because it's so much extra work, in my opinion, than nursing. So anyway, I loved nursing, being able to nurse Palmer through 1 year old. I feel like that was really sweet. And I do think if you can, breastfeeding has so many health benefits that it just felt good to be giving that to her. But then, yeah, weaning was crazy. I had never heard people talk explicitly about weaning, which is just like when you're getting your baby to slowly stop breastfeeding. You feel like you're pregnant every time you wean the tiniest bit because your hormones are having a big fluctuation again. And every time my hormones fluctuate at all, I'm like, feel pregnant. I get so nauseous and bloated and tired and brain fog. And the crazy thing, Palmer, she naturally weaned. Like she was so bored and was just like wanting to go play.
You're like, this is our moment. Come on.
This is our time.
Aren't
And
you
then
sad?
she's just like, let's play. So that made it better that I wasn't like, it felt very natural.
Yeah. Well, it really is amazing that you were able to do that for so long. Well, job well done.
Thanks.
She's such a cutie pootie pie.
She is. Oh
She's
my
looking
gosh.
like a little girl. Like
Yeah.
she just, I don't know. She's waving. She's starting to like say some words.
Yeah.
She's really, really cute. Okay, I have some questions for you. I was going to ask you what your top 5 values were, but that feels very dramatic. So I'd love to know, what are some things that you value like in this season of life as a 31-year-old? Oh my gosh, happy late birthday. Kruesi turned 31.
I did.
3 days ago?
Yeah. Thank you.
We're kind of in the middle of like a birthday weekend, so happy birthday. And tell us about things that you value as a 31-year-old.
I think being there for family is a huge value of mine. So specifically my nuclear family, like I really try to prioritize my husband and my baby as far as like what I'm giving out to the world. They need to come first to me. And then a little bit bigger, our immediate family. I think that's a huge value of mine, just family in general, because it's such a long-term relationship and so much good can come out of that. Being sure and bold in my faith is really important. So I'm a Christian, and I think my faith really does shape all of the decisions I make, and I hope that it's shaping the way I think and the way that I talk and act. I have some tattoos on my wrist from Psalm 19:14, which it's in Hebrew. It says, "My rock and my redeemer." And the quote is, "May the words of my mouth and the meditations of my heart be pleasing in your sight, Lord, my rock and my redeemer." So I always think about like, that's a huge value of mine. The meditations of my heart and the words of my mouth should be in line with what I believe. Let's see what else. I think in general, health, like my personal health is really important. And foundationally, it's like good nutrition, exercise, sleep, stress management. But more recently, I've been really focusing on inputs and like, what am I watching? What am I listening to? Who are the people I'm surrounding myself with? Like those are all really important parts of my health. And I think the last one would just be continuing to get clear on my passions and what impact I can make on the people around me and in the world at large, and driving towards that. And I've recently gotten kind of into, it's not manifesting, but more like visualizations and just being quiet with myself and either journaling or dreaming, or sometimes I'll listen to like, there's an activations app that this girl, Mimi Bouchard, started, that I'm honestly kind of trying to figure out, like, is this in line with my beliefs, or is this like secular, or is it
Mhm.
okay that it's secular because I can then interpret it through like my lens as a believer?
Mhm.
Anyway, it's kind of like a manifesting, activating
Yeah.
app where you just get clear on who you are, what you want, and it helps you kind of shape the decisions you make.
Mhm.
So, yeah,
Yeah. I think the term like dreaming, being
dreaming.
curious about your future has maybe less connotations around
Yes.
that stuff. Love it. What season of adulthood has brought you the most growth or change?
Oh, right now I'm in it.
Mm.
I feel like having kids has been definitely a huge growing season for me because it has made me have to come to terms with how selfish I am. And
Mhm.
Ethan, my husband, and I talk about this a lot. We're like, becoming parents has been our favorite thing in our lives so far. It's been
Mhm.
so fun, but you really have to be selfless in order to function as a family because a baby requires a lot of attention and love and affection. And there's so many times when I can't do what I want to do because something changes with the schedule. She needs me. She's sick. I have to be willing to say, you know what? You are more important to me than
Mhm.
overachieving at work. You're more important to me than squeezing in this workout. You're more
Mhm.
important to me than being able to go have drinks as with friends as frequently as I was before. And
Mhm.
truly, that's how I feel like she
Mhm.
is. And there's no question about that. But it's been just interesting to realize how selfish I am.
Mhm.
So I think becoming parents, but it has really helped me get to know myself, and it's really helped my marriage too.
Mhm.
Like I feel like
Mhm.
we're so much closer and we're so much more vulnerable. Like there's less of a lens in front of both of us, I think, because we're just like, it is what it is.
Yeah.
We've broken down in front of each other more than we had before.
I was going to ask you if it feels easy to make those decisions of like choosing her over the other things. Cause I
Yeah.
do feel like that's a fear of mine is feeling any kind of resentment or just like wishing I had more time or something. But it's like that is the desire. That is a true desire of your heart. And also it's just like, I wish I could do these things.
Yeah, exactly. I mean, it's very intuitive for me to prioritize Palmer, and it doesn't feel like a loss ever. But
Okay.
there are times when, and this is where you have to just communicate well with your spouse. There are times when I'm like, okay, I need you to step in and
Mm-hmm.
I need to go on a run or I need to go hang out with a friend. I just need to
Yeah.
do that and being honest about that. But it really is easy. Like I think that surprised me because I was nervous about feeling
Mm-hmm.
resentment towards the life I had. But
Mm-hmm.
that's another reason why you shouldn't rush to have kids if you don't feel ready. But at the same time, I've realized that the really good and grounded and pure side of me is like ready to have kids.
Mm-hmm.
And the side of me that's overachieving and wanting to prove something or feeling anxious is not quite ready because I'm fearful of what it will change in my life. And I think a lot of women, if they're honest, might be able to say the same thing.
Mm-hmm. Yeah, I've heard people say once you have a kid, you realize, like, oh, my life was good and I was very content, but I had no idea, like, the richness or the fullness of
Yeah.
what it could be with a child.
Yeah.
So I do think it's a whole paradigm shift
Yeah.
that I really believe that, but until you've experienced it, I don't have a category for.
And it's
Yeah.
like the love that I have for Palmer and the love that I have for Ethan because we made Palmer
Mm-hmm.
is like I've never experienced that kind
Yeah.
of love. It's so different and it puts things into perspective because I'm like, I do not care about so
Mm-hmm.
many other things. And
Mm-hmm.
that's not to say, I mean, I've had a lot of postpartum anxiety, so that's kind
Mm-hmm.
of different, but it's just made me kind of zoom out in a cool way.
Yeah. Is most of the anxiety around Palmer's health and well-being?
Most of my anxiety, I did not initially have postpartum anxiety. Mine came after I had a delayed postpartum hemorrhage at like 5 or 6 weeks.
Mm-hmm.
And I was just like so fearful of my health.
Mm-hmm.
And I didn't really know what was going on with my body. It wasn't very clear when I left the hospital after being readmitted for that we had solved the problem.
Mm-hmm. Probably for the first time, like actually fearful of dying,
Yeah,
like
I really was.
experiencing a near death
Yeah, and I had
situation.
never felt that before. And I think just in the moment when that was happening and I was kind of like being rolled back to the OR and I was being separated from Ethan and our tiny baby.
Fresh baby.
Yeah,
Yeah.
it was such a real moment of like, holy cow, like what if I don't get to see them again? And
Mm,
in some ways that feels dramatic to say because a lot of people have pregnancy complications and thankfully modern medicine, we can usually save the person. But it was definitely a crazy moment. And I do think it was very traumatic, like physically and emotionally. It just put me in a spin of anxiety for a while. I feel like I'm honestly just coming out of it.
Kruesi's an amazing mother. It's been really fun. I just feel like you have very seamlessly stepped into the role of motherhood. And I very rarely, I don't even know if I've ever heard you complain about things related to motherhood. I hear that from other people sometimes, and not that that's even bad, but you've made me like really excited to be a mom.
That's
So,
good. Yeah,
and just it's fun to have a role model to go before you as the oldest sister. It's helpful. Yeah.
it's one of those default things I think we do. Like you and I talk about, like, we a lot of the times our friends or people in our age group default to talking negatively about their marriage or their relationships because it's like easy and it's funny
it's
and you can,
relatable.
like you can gab with anyone on it, but that's not what we don't want that.
Yeah.
We're not about that. We love our husbands to death.
Yeah.
And like we're for them. So we need to be cheerleaders for them. And so it feels the same way with parenthood, where it's like, I know Palmer is the biggest gift. Like I don't deserve her. She's so amazing for me to have. And it's such a gift from God. And so if I can keep that perspective, all the annoying little things that come with that are like, they don't matter.
Yeah.
And then I don't get in the trap of only talking about those annoying things because I'm like, no, Palmer is the hugest gift. There's so many people who cannot get pregnant and can never experience this. The fact that I was gifted with that is like, that's what I should be talking about.
Yeah.
So
I do think it becomes a habit. So
yes,
I echo that. And it's to your, what was it? Psalm
1914.
1914.
Yeah.
You're doing it. Okay. Dream hobby. So think of like take out money or time or resources. What would you like get really excited to put your time and energy towards?
Oh, I've got dreams. One, tons of tennis. I would play tennis all the time.
Okay.
So I need a tennis court.
Okay.
And I need like a clubhouse to play at.
Do you like the vibe of a club or just
no? I need my own.
Oh, okay.
My own tennis court because it has to be very convenient.
Okay.
And I can like have people over all the time. We can like play tennis, jump in the pool, hang out.
Okay.
Yeah. So lots of tennis. And another hobby I would love to have if I had the land and the time would be to grow a ton of fresh produce and probably have chickens. Like I just love having access to fresh, good food. So I think having like a farm and a garden, probably only chickens would be the only animals.
What is your favorite thing about your husband? What do you love about him?
My favorite thing about him is he has so much integrity in his words. You will never hear Ethan say anything he doesn't mean.
Yeah.
And I really have grown to love that about him. I would say he doesn't hand out compliments like candy. Like the compliments I get are sparse, but when he does say something like kind,
it almost means more.
It does. Yeah. It's so genuine, and I know he's been thinking about it for a while, and he has thought through the implications of telling me, and like he's just so thoughtful and he has a lot of integrity in his words, and I really like that. And I think it helps him be a really good leader, like in his work and with his friends, because when he says something, he means it.
Yeah. Ethan told me one time, he was like, "Oh, your hair smells good." I literally was like, "Oh,
thank you so much."
That's the biggest compliment I have ever received because it came from Ethan. And also I'm like, really?
Yeah.
I don't have like good shampoo or anything. And I like that has stuck with me. It's like given me confidence. I'm like, ooh, my hair smells good.
And then like the flip side, I come down for a date or something. I'm like, do you like this outfit I've been working on for 30 minutes? I've tried 10 on. And he's like, it doesn't really work.
Yeah.
And so I'm like,
but it's so helpful.
Glad to know. Like, let me go try again.
Yeah. I feel like I love Ethan, and I think he also, like, with people, he's very kind to everybody, but he's not just going to, like, give all of his energy to this random person. And so when you do get to see him or have a conversation with him, it does feel like he cares, feels very genuine. Yeah, I respect that as well. I was going to ask you your ideal Friday or Saturday night, but that seems kind of lame now.
Why?
I don't know. I feel like...
Okay, here's my answer.
Okay.
It's not a Friday or Saturday night. It's a Saturday morning. Love a Saturday
Okay,
morning.
well, the only reason I was going to ask you about night is because I saw that you were going to ask me about the morning.
Oh, shoot.
But do morning.
Okay. My ideal Saturday morning, I sleep in and I wake up naturally around like 7:30
Wow,
a.m.
so sleeping in.
Well,
I knew you were gonna say that.
baby, yeah, usually it's 7. So if I sleep till 7:30, so lovely. Palmer wakes
Mm,
me up with her little cute noises from the next room. And then Ethan and I just have like a fun morning with her. We have a espresso machine that I love, so we make our
mhm.
cappuccinos in
Oh,
the morning. We just get to hang out, probably sit on the porch. And then my favorite thing would be to do some sort of activity outside. So like ideally a long walk or go play tennis and then go get a really good huge breakfast.
yum.
Yeah, that's my ideal
Maybe
morning.
a coffee crawl
Yes,
after that.
for sure.
Love it. Well, there's lots of things we could talk about. Kruesi is many things. One of those is a PA. I would love to know, well, is it a physician's associate or physician's assistant? And I've asked this 10
No,
times.
you're fine. So it's currently the AAPA, which is the American Academy of PAs, have changed the name PA to be physician associate because it embodies what we do.
Mm-hmm.
More states are slowly changing the legal name to
Okay.
physician associate, but it just depends on where you live. So I still say physician assistant usually
Mm-hmm.
because that's what most people know, but I think like technically nationally the name is physician associate.
Okay.
Yeah.
If you introduce yourself as a PA, how often are people saying, what's that? Like, what's a.
Not that often.
Okay.
Interestingly, I think usually if people have like gone to the doctor or been in the
Mm-hmm.
hospital, they know what a PA is and
Mm-hmm.
they know what we do. But sometimes like the older generation, like above 70,
Mm-hmm.
will not know and they'll
Mm-hmm.
call me like a lot of times they'll call me doctor or they'll call me nurse. It's,
Mm,
they just like don't have a category
that's
of
hard.
what's
Yeah.
kind of in between.
Okay.
So
But if you walk into a room to a patient, do you say like the doctor's name, like you're their associate, or do you just say, hi, I'm.
no, so technically it depends on where you work and what your role is, but I do have a legal attending physician. He's my
Mm-hmm.
supervising physician, but
Mm-hmm.
I could be working under like his group. I'm not like his assistant
Mm-hmm.
specifically. I'm working as kind of like a middleman
Mm-hmm.
to make my own assessment of the patient, come up with what I think is a good treatment plan, and then I like talk it through with my attending
Okay.
physician and see if they agree or if they want to change anything.
Mm-hmm.
But yeah, I when I walk into a room, I say, "Hi, my name's Kruesi. I'm a PA with the
Okay.
kidney team," is what I say.
Cool.
Yeah.
So smarty. We've talked about this a little bit, but the schooling and training to become a PA is extensive. It's intense. Tell us a little bit about how to become a PA and then any like tips or things you would tell yourself if you could go back or someone interested in pursuing being a PA.
Yeah, that's a good question. I was not prepared for how intense PA school was. I went to Emory. I worked for about a year and a half before I went to school as a medical tech in an internal medicine clinic. So I did have a lot of experience in the medical world, but I didn't have the like medical knowledge. So jumping into PA school, basically we are trained in the medical model, but
Mm-hmm.
it's very condensed. So it's typically 2.5 years of
Okay.
schooling, and that includes the didactic portion, which is the coursework, lectures, and then the clinical portion, which is where you actually apply what you learned and you do rotations in all types of different fields.
Mm-hmm.
And then after you graduate, you apply for your boards and then you take a board exam and then you have to get licensed by the state. It is similar in the way that we learn medicine to how a physician learns medicine in their initial 4 years,
Okay.
but very condensed and therefore more generalized. So physicians have a lot more in-depth knowledge of specific topics
Mm-hmm.
and they get to spend a lot longer on each course. They get to
Mm-hmm.
spend a lot longer in their clinical rotations. So they do have a lot more experience. And that's why I think as a PA, I feel so confident in my knowledge because I'd learned so much in the 2.5 years that I was in school. And I feel like I got such a good foundation of knowledge.
Mm-hmm.
But I in no way want to be acting like I could be fully autonomous on my own,
Mm-hmm.
making really intense medical decisions.
Yes.
I like the
Yeah.
position as a PA where I can lean on my attending physician
Mm-hmm.
and collaborate with he or her and get their take and their experience on, they've seen this type of situation maybe hundreds of times,
Mm-hmm.
whereas I
Mm-hmm.
haven't yet. So I think it puts me in a really cool spot where I feel very confident and comfortable with what I'm doing. And never do I feel like, ooh, like, I don't
Yeah.
know know if I should be doing this. Like, I feel very comfortable. And typically, there's a very collaborative experience with the
Mhm.
physicians. Like, we're definitely a part of their team.
Mhm.
Typically, we're treated with a lot of respect.
Good.
But at the end of the day, like, they always have the final say. And I
Mhm.
always respect
Yeah.
what they think we should do. And I do that.
Mhm. And they're somewhat more liable
Very
to
much
yeah.
so. So yeah, like my license is in a way like my supervising attending is saying, I think this PA knows what he or
Mhm.
she is doing
Mhm.
and they can work under me. So yeah.
And a physician is just a doctor.
hmm A physician, gosh, it's so confusing right now because so many people use the term doctor.
Mhm.
Doctor kind of like,
Well, honestly, like before working, a physician, I wouldn't really know what that means.
yeah, okay, well,
So.
so this is helpful. A doctor just means you have a doctorate degree. It could be in anything.
Mhm.
It could be
Okay.
in medicine. It could be in
Occupational therapy.
literally, yes.
Mhm.
There's nurse practitioners who have their doctorate degree in nurse practitioner and they call themselves doctors. I do kind of disagree because I think it really confuses patients.
Mhm.
NPs can be fully autonomous in some states, meaning they don't have to work under a physician,
Oh
which
wow.
some people disagree with that. Personally, knowing the schooling that they do it's a different model. It's more of like the nursing model in some cases than PA school. Personally, having a similar experience of education as them, I would not feel comfortable
Mhm.
being fully autonomous.
Mhm.
Okay, so a doctor could be anyone who has a doctorate degree.
I
You could
see.
be like a doctorate in
Like
philosophy
just
or
have gotten
something.
your PhD in
Yeah, or in
something.
chiropractic.
I
You
see.
could be a doctor of naturopathic medicine, which is very different from a physician. So a
Mhm.
physician is a protected term. That means you're either an MD, medical doctor,
Mhm.
or a DO, a doctor of osteopathy.
Mhm.
And those are like 4 years of medical school, 4 years of residency, and then a lot of times a fellowship.
Okay.
Yeah.
Okay.
You have to get a lot of patient care hours before you can even apply to school. Getting into PA school can be very hard. You're not allowed to work during PA school because it's all consuming. It's all you do is study for
So
that time.
much.
So you're learning medicine, you're learning how the body works optimally, pathology when things go wrong. You're learning about pharmacology, all the drugs, their mechanism of action, the side effects, who's contraindicated, who should be getting it, all of that stuff. And then you learn all the anatomy. So Emory had a cadaver lab. So we actually went
Cool.
into like the dungeon of this building and there was all these bodies who were deceased and wanted to donate their organs. And we got to actually dissect and learn the
Wow.
anatomy, which was really helpful.
And like, had you ever? How do you know if you can handle that?
You don't till you
Like,
get in there. It's
was there anyone
intense.
that walked in and maybe you're not pursuing surgery or something and realized like I can't do this?
Yeah, and it's weird. It's not even like your senses, like it can
Mhm.
like smell bad or be scary to look at or overwhelming. It's more emotional because you're like, this
Mhm.
was a
Mhm.
person and now they're gone and you
Mhm.
just kind of feel like, wow, this is
It's a
someone's life.
body.
Yeah,
Yeah.
it's kind of strange. So yeah, you do that. And then I think I did 13 rotations. So that's like family
Wow.
medicine, general surgery, pediatrics, women's health, which is like OB-GYN, dermatology, rheumatology, emergency medicine, all of those. So
Is that comprehensive? Is 12 like
yeah.
okay.
So we are trained as general providers. PAs are really trained for primary care, family
Mhm.
medicine specifically, but we have the knowledge to then go do any specialty. You just have to find someone who either they have a fellowship for you, so you're in like a learning
Mhm.
mentoring program, or you just find a good team who's willing to teach you like
Mhm.
the ins and outs of the specialty because that's how I'm like a forever learner as a PA. I'm never going to
Mhm.
get to the point where I'm
Awesome.
like I know everything. So
Yeah. So your scope is large and you could kind of do anything. Like there's not are there any additional trainings you would have to get or you just have to find a physician that's willing to take you and teach
yeah.
you?
Yeah,
Okay.
pretty much. And that's the
That's
beauty of it
awesome.
is like we are really meant to be collaborative
Mhm.
with physicians and easily trainable and like adaptable. But yeah, we can prescribe medicines, we can assist in surgeries.
Have you ever thought about surgery?
No, it's so
No.
crazy. I went into PA school saying I wanted to do neurosurgery, which is so
Woo!
laughable because I love anatomy. I geek out over anatomy. It's so cool to me. And I've always thought I have like a really nice steady hand.
Hmm. You do. You're
I
an artist.
But I don't. I
Oh.
went into surgery and they would a lot of times have me do the final suturing, like stitching up the patient after the surgery. And my hand, guys, was shaking. I have what's called an essential tremor.
Oh
Dad has
no.
it too,
Yeah.
and grandfather. If I get anxious, my hand, like, and I'm, especially if I'm intentionally doing
Intention
something.
trimmer.
Sorry,
That's what I was
it's
gonna
called
say.
an
Okay. An intention trimmer. You said, I don't know
intention
what you said.
trimmer.
Essential?
That's what I meant to say. If I'm trying to do an
Crazy.
intentional movement and I'm nervous, my hand shakes like crazy. And I mean, like, to the point of it, so embarrassing.
They're like, okay, stop.
Yeah, and, like, I can do it, but if
Yeah.
anyone's watching me, I'm like,
Yeah.
sorry, I'm being
Which
so
would
awkward.
probably go away eventually, but like, how
It
are
would,
you
but
gonna
I couldn't handle
get there?
the embarrassment. So no, I will not ever do surgery. I could do
Okay.
derm procedures for sure because
I'm
it's
picturing
like,
like a hole punch.
yeah, and like a shave, and I can suture up
Mm.
little things, but something about being in the OR, it's like
Ugh.
this like freezing
Sterile.
cold, white, sterile, like super intense setting, in my opinion. Some people
Mhm.
love it. It made me so nervous. So no, I
Yeah.
could not wait to get out of there every day. I
Mm.
hated it.
Tell us about what you have done, the places you've worked.
I started out in the hospital, in one of the main hospitals in Atlanta, working for a pulmonology group. Pulmonology is the lungs. So we were a kind of different than a typical lung group because we admitted our own patients in the hospital, meaning we were the primary team over everything that was going on with the patient.
Mm.
As long as they had a lung issue that brought them to the hospital, we would be
Okay.
the primary team. So that would be like pneumonia, asthma, COPD, a pulmonary embolism, respiratory failure. But then we would also manage their diabetes, their kidney disease, their heart failure, stuff like that. So I did that for 2 years. Great learning experience, but honestly, it was a hard job. I was very anxious a lot of the time because the patients would decompensate a lot. And like we would be the first ones to go and figure out what needed to be done.
gosh.
And some people are cut out for that. And I just think, I don't know. I think
You're
I
just watching
could
the
be cut out
numbers.
for it.
Ding, ding.
Yes, it just made me really anxious. And then I would
Yeah.
take it home with me and I couldn't sleep and all that stuff.
Mm.
So I switched into, after having Palmer, I switched
Mhm.
into a role with a kidney team. Any patient with a kidney disease could be like an acute problem or a long-term problem, like if they're on dialysis, or kidneys also would be involved in like volume issues, like if you're overloaded or if you're dehydrated, or electrolyte issues.
Cool.
So that's what I'm doing right now.
Nice. You've kind of answered some of these, but what's something you've learned about yourself, either through school or just being in like the medical setting, working in a hospital, working with sick people?
The main thing I've learned is just slow down and listen to the patient. Slowing down and just being present is probably not my natural response. I'm a very fast, efficient, productive person. I like to just get things done, but that doesn't work in medicine. You can't just like crank through an assessment of a patient. Lots of times you'll get to the answer by just letting them talk. And so I've had to learn that. And I think that's been really helpful for me in life too, just to realize like sometimes just slowing down and being more observant is actually more beneficial than interjecting your thoughts and speeding through and trying to get to the point.
Well, I feel like a common complaint I hear about physicians is that it doesn't seem like they have time to listen, and the PA or whoever else is involved sometimes can fill that role, just maybe based on like your capacity or your workload or something.
Yeah.
So I think that's a huge strength if
I
that
think so,
if
too.
you're doing that.
I think so too. And yeah, typically, like if you work in an outpatient setting, typically we don't have to see as many patients as the physician does. So we can spend more time. And I think that goes a really, really long way.
Yeah.
This is funny because I honestly think if I could go back and tell myself something, it would be to not try so hard. I think I just stress myself out unnecessarily, being like, I must know everything that is I'm told. I must memorize it and know it, not just like in a simple way. I need to understand all the details of it. And it's like, yeah, I think that served me really well, but it also made me so stressed and anxious and just like miserable for the years that I was in school and for probably the past like year of working. I would just say try to enjoy it a little more. Just try to enjoy learning. And then the piece of advice for someone who's starting out, like trying to figure out what they want to do for work, it would be just do what you want to do. I think a lot of times there's pressure to like do the hard thing or
to get to do the next thing or something.
Yeah, like do the intense thing. So and do the thing where you can get taught everything so you don't forget anything. But looking back, I'm like, no, do what you want, what you're actually interested and passionate about, because that's going to lead you where you want to go.
Yeah.
You need to do what you're actually interested in and passionate about.
What about really specific things for people who are nervous about interviews or how to study for boards or anything like that that you wish you had done differently or that was especially helpful?
For studying, I really liked Anki, Anki. It's like a flashcard thing. You can download pre-made Anki decks for like
Oh, yeah.
any specific topic, which is really helpful. Saves you a lot of time. For interviews, again, it's just try to get clear on what you're looking for and what you're passionate about, because that definitely comes out in an interview. And people, I think, always would prefer to hire someone who knows themselves
Mm-hmm.
and knows what they want out of the
Mm-hmm.
role, because then you know if it's a good match or not. So I'd say just get clear on who you are, what you want to do, and then let that show through the interview.
Yeah, it's definitely a lot of work, but I got to watch you go through all of like the interview stage, the actual school, getting to the job. I've seen a lot of videos on social media of like me crying about the job I like cried for, like cried to get, like
Yeah.
I'm here, like I made it. But the job itself, it's still a job. Like it's still
Yeah.
hard, it's still work. I feel like you've done a good job of, at least at this point, it's not your whole personality, it's not your main purpose or passion. So I think that probably makes it more enjoyable. Overall, are you happy to be a PA? Is it kind of what you hoped or expected?
Yeah, I'm happy to be a PA. I think it's really helpful for me to feel like I've worked really hard at something specific and now I get to use that in a very specific way. It's just I don't know, it's a cool kind of like piece of confidence that I have to know I was able to get through that
Mm-hmm.
really well. Like I put a lot of effort into it,
Mm-hmm.
and now I have a skill to provide to people that's very specific and helpful. I will say it's been an interesting transition now being a mom and realizing so much of my focus and my passion is
Mm-hmm.
family
Mm-hmm.
now, and I want that to be the case. Like that's not upsetting to me, but it has really taken my focus and attention off of medicine in a lot of ways. So just trying to figure out like how to navigate doing both to the best of my ability and prioritizing what feels natural and good for me to prioritize and kind of like holding boundaries at work. That it's really hard. Like it's hard. I'm a people pleaser. It's hard to not want to fudge my boundaries and accept more hours
Mm-hmm.
or stay late or like keep trying to be like a perfectionist at work.
Yeah, you also went to like one of the most highly ranked schools,
Yeah.
top of your class at a very impressive first job. So I think it's somewhat of your personality. Like you can't do anything except for all out, which is
It's
amazing
true.
and hard. Like there's no real way to split that.
Yeah, I think now what I'm trying to do is really use that skill in a way that's like really getting me where I want to go. It's not
Mm-hmm.
doing what I think I should do. It's
Mm-hmm.
not doing what's the most people pleasing or the most impressive from the outside. It's like, okay, well, how can I really use this in a way that feels like me and that feels like what God's pulling me
Mm-hmm.
towards? Like honestly, I think eventually I probably won't work in a conventional medical setting because it doesn't feel like truly in line with like who I am and what I'm about.
Mm-hmm.
We need people to work in like traditional conventional medicine. We need that. But for me, I'm like, I don't know. I feel there's more for me. There's a bigger picture. There's more coaching and encouraging and focusing on like true health and vitality to me gets me so much more fired up
Yeah.
than what drug and what intervention is needed in this specific setting for a sick patient. Like
Mm-hmm.
that's been so cool to me to learn. But when I'm really passionate and like this is what I'm made for, it's health, vitality, helping someone really, really feel good. So
Hence the podcast.
hence
Nice
the
job.
podcast. Yeah. And we'll see what can come from here and talking about like dreaming and getting clear on what I want. I have gotten really clear on like, okay, this is what I'm passionate about. So let's see what doors open and let's see
Yeah.
where things can lead, because I believe that I have these motivations for a reason. I'm designed in a certain way and I want to figure out how to bring that out in the most authentic ways I can. So.
Nice. 31 years, you've done a lot of things already. It's exciting to see. You've already done it in some ways. Like you did it. So now you get to make it exactly what you want it to be.
Yes. Yeah.
I like it. Anything else?
No, I think that's great. I think if you're interested in medicine, if you want to be a PA and you want to reach out to me, I'm so happy to talk about the ins and outs of how things have gone and where I'm at now, especially as a mom, like how it's been balancing two things, working part-time, all of that. I'm happy to talk about it.
Thanks, guys. We'll see ya in the next one.
All right, bye.
Bye.